T. Jibin Fufie is my name, a student of higher education diploma in social work. The following are the contents. 1. The body stress stimuli. 2. The possible psychological responses to stress. 3. The relationship between stress and illness. 4. Biological and psychological methods used to reduce stress. Body stress stimuli. Physical structure in an individual is termed as the body. And the body has so many parts, of which brain is one, heart is another one, spinal cord is another one, nervous systems, and so many of it. But we realize that stress has links with the brain, of which we have to know what stress is. Stress is any form of changes that occurs in the body. The changes might be seen through physical or psychological, or one may say emotional. With the physical aspect, you may see the person's mood changes. As I've placed the picture over there for us to see how people look like when they have a physical change, when he or she has been affected by stress. Most of the times, stress rates from the brain, and you may see the person wiggling his head or her head. In most cases, you might see some people talking without talking to anybody. You might see the person become very quiet and moody. All these shows the signs of stress and the factors based on the psychological or the emotional changes. That person may be thinking. You see from the face, it's a busy thinking about something. You may also see the person waving the head, marching up and down without having any focus. He might go there, come back, and ask him or herself, what am I doing? Because anxiety has taken place, depression has taken place, and also you see that the person is really disturbed. Stress is not something that is good. Mostly have the physical and psychological changes in humans' life. So whenever it comes to that point, we should consider those two major areas that influence or being a stimulus to the stress, that is physical changes and psychological changes. The next point I'm going to talk about is the possible sociological and psychological responses to stress. I've already told you that the two major areas that mostly stimulate or promote stress is the physical changes that you may see, and then the psychological changes that you see. This time round, we are going to focus on the physiological responses to stress and then the psychological responses to stress. First of foremost, we talk about the high blood pressure. When somebody has been influenced by stress on physiological way, the response may be high blood pressure. That's the first point. The person may have heartbeats that is faster than the normal is supposed to be. There you see that there is some frightening system, or the person is being feared of something. So it affects the heartbeat or the pressure, we normally say. The heart diseases, the person might have some diseases that will disturb the person's heart, of which the person cannot be of him or herself. Another one, you see the person will be obese. Obese in the sense that there are some social, physiological effects on that person. You really see that he's growing big without knowing the reason. Because the systems are not working well, if you drink, you'll be obese. If you not sleep well, because that's stimulus that is sitting on the brain, on the body, it cannot reason well, you grow fat. It is diabetes, because the system are not working well. The insulin that's supposed to work with the food intake and then also work effectively for easy digestion, the insulin will not provide, the natural insulin will not be coming out to work with the food that you have taken. More so, the person might not be having a regular exercising. So it's going to affect you to have a diabetes. And all these things are physiological responses to stress. Let's move to the other side, that is psychological response to stress. The person might get confusion, easily be confused about a little thing that you place it on a table or for discussion. She cannot reason well because of the responses of stress. She begins to think unnecessarily. Anything that you as individual may not take it as easy, you find it easy to come out with. She will stay with that thing for a long time because something is over the mind. She cannot reason well. Depression can set in as a psychological response to stress. The person will be depressed. The mood swing become difficult to change, to correct, because she has been response to the depression. Depression comes to the person and he cannot do things of his or her own. Sometimes you need to prompt the person. He must be depressed because of the stress responses to the brain. I've already told you that brain is the main focus, that everything passed through there, sent to the central nervous system to work within or pass through the peripheral system with the muscles to work well. In our previous lesson, we talked about a lot about the brain. So I know for sure your physiological and psychological responses to stress might be some of these examples stated. The relationship between stress and illness. Stress has a lot of things that always plays negative aspect or negative change to human beings. Stress comes in the form of a disturber to the brain. When you are being affected by stress, you see that you will not feel comfortable in your own self. You see it in the physical being, like you see it in physically and emotionally. The physical aspect may drag you from being associated yourself with others, and an emotional aspect will disturb you not get closer to any person, or you being reserved because the moon swing has changed. And if these things has come gradually and you don't settle up, or you don't try to solve that issue, you realize that it leads to another step or another level, of which it becomes chronic. And when stress becomes chronic, it affects you mentally, psychologically, physically, and a lot of things comes into your system. You really know that you are not of yourself because stress is over you. And these may have influence on a person to become sick or ill. These illness can be depression, anxiety, not feeling fine or relate yourself to other people. Socially, you will not be friendly because there is something disturbing the brain. And you can observe it from one who has been stressed, attacked. In this case, one needs to be very careful of any kind of stress that you go through. You need to prevent it using the stress techniques to manage it well. If not, and it takes longer time before settle up or before working on that, it becomes chronic. And when a depressed person or a stressed person has been affected by a stressed person has been affected for so long, it becomes an illness to the person. One may be not sociable. Another disease may be dementia. Another disease may be so many of them you can think of. So these things will distract the brain. Since it have link with the brain cannot reason well, of which it's influence that to become a stress. And when the stress grows, it become an illness. So there are so many relationships between them. Note that this is a stress. Know how you go about it so that it not be a chronic type and it will lead to illness. Always focus on your health. It is very important to identify what you are going on and start or begin to tackle it once and for all. If you sit there doing things like a physical way, it might lead you to illness that treatment will be very difficult. So stress and illness have so many relationships that one needs to be careful about whenever you are being affected by stress, and then don't sit there for it to grow to become illness. Biological and sociological methods used to reduce stress. We have biological methods, which are physical activities, meditation, deep breathing techniques, social supports like counseling. And we also have psychological methods, that is progressive muscle relaxation, mindfulness, and exercise and stress relief. To begin with, we'll focus on the biological methods. Physical exercises like trotting, like skipping, like press ups, they are all helping to solve stress. Or be meditating upon something like the storybook you read or a film that you've watched. You need to do constant deep breathing that will help one to come over a biological stress. Social support. You can visit recreational centers in your community to have a counseling, by of which that person, the counselor, will advise you what to do and come out from that stress. Physiological methods can be progressive muscles relaxation. Those ones are being relaxed, the muscles, for no work hardly, so that it will trigger a lot of things in the system, but do things in moderation. And then mindfulness is the way of mapping things that you want to do in a day that will also not disturb or overwork or reasoning about a certain thing. Do mapping over that. One needs to exercise regularly to relieve oneself from stress. If not, practicing these things regularly is going to affect you and you may have stress. So need to apply the two types of methods that we use in reducing stress. In the nutshell, we have explored in a psychobiology of stress. We identify things that has influenced each type of stress that attacks the body. And we also known how it has influence or triggers when we don't take proper preventives. So now we know what the stress is, and we now identify what to use to combat it. I'm sure that at the end of the day, any type of stress that comes around across your way will be dealt properly, so that it will not be chronic over you to become illness. References are under the write-up. Thank you.